Bantle Setlhako. I'm a medical officer in Mahalapet district. I cover both the clinics and the hospital. And I did complete previously an MD MPH program, which might be relevant later. And I just did a course in Respiratory Medicine, Postgraduate Diploma in Respiratory Medicine, and I'm to start the Master of Science, Respiratory Medicine. So basically I did an MD MPH degree previously, and my interests really are in health promotion, disease prevention, and community engagement and education. So I also worked previously with men who are sick, and my other interest is dealing with people who are disadvantaged. And in this case, men in the healthcare system, we know that they don't access healthcare as usual and so forth. So when I was doing my rotation there, I got interested because a lot of men were suffering from respiratory diseases. And what I did is I enrolled in this course because I wanted to broaden and review my knowledge in respiratory diseases. And I am happy that I did this course with Merck Foundation, as allowed by the Ministry of Health. And with the knowledge, I've been able to set up what I would normally call a mobile clinic, where I'm able to reach patients closer to where they stay. And the reason why I find this important is that men, like I said, they don't normally come to the hospital easily. And even though initially we wanted to set up a clinic in the hospital or in a bigger clinic, I ended up seeing that it would be better for them financially, and also they feel more comfortable in their villages. So I do cover different clinics, maybe about 6 to 8 at times, including the hospital. So I see men where they stay mostly, that's my interest. And I've seen patients who are ex-minors, I've seen patients who suffer from what would previously have been termed asthma, but really I would go in and try to see what could it exactly be, and then I refer them accordingly. It was a great course in the sense that it was also offered online. It was somewhat convenient. Yes, we did have deadlines by the end of this, by Sunday submit this, but it was very convenient. You could do it at your own time. The reflective journal is one thing that I benefited from. I had heard about and I was able to take part in it, and it helped me professionally and self-development. And with the other part that I really enjoyed and appreciated, which was new, was the module activities. Whether it was in the group work activity, for example, when we did rehabilitation, something that I'm actually passionate about. There was also times when we did a scientific poster, and I actually got to realize that not even everyone knows about that, those who have done some masters. So I was really happy to do that. And also that the student community is very diverse. I'm one person who thrives where there's diversity. And we were able to discuss both on the social platform and on the discussion forum, which is the academic forum. So I definitely enjoyed that. With the course, I found it useful. For me, it was more like a revision, but at a slightly higher level, in the sense that we looked at evidence-based medicine, and everything that we discussed had to be evidence-based, right? And that is something that I also am interested in. So I was able to enjoy the discussion forums, and one of the ones that I found very useful was the reflective journal, which I feel developed me professionally, made me reflect a lot, and also personally. But I'm also happy for a lot of the staff or the tutors that we had who were supportive, most of them. I tend to move through different facilities, right? So I tend to engage people who are working at the facilities. For example, nurses, when we are having a patient, because sometimes I consult in the other room. If there's space, consult in the other room. So when I have an interesting case, or something that I would see, I give them feedback, or I allow them to, we do a bedside teaching basically. And in other cases where it's relevant, I discuss also with other allied professionals. I know, okay, I'll give an example. There's something that I started recently and that I want to take even further. It's smoking cessation, because as a from the public health perspective, you know that smoking is a big risk factor. Even from respiratory, smoking is a big risk factor for respiratory diseases. And there are a lot of people who smoke, and some of them, they know the effects, but not everyone sits down with them and talks to them. So I do identify patients who are smokers. Sometimes they actually don't tell me, but I see it, like during my infectious disease clinics. Through a quick physical exam, I can already tell this person is a smoker or even uses other substances. And then gently I tell them that, and they agree. Okay, they admit I am a smoker, and I would refer them to my medical clinic. With referrals, I think currently in our country we have no pulmonologist or respiratory medicine doctor who's in the public sector, or if there's any, there's very, very few people, definitely less than 5. But I know there are other, maybe 1 or so who's in the private and so forth. But when it comes to referrals, what we would normally engage a physician, or when we need interpretation of imaging, for example, like a chest CT, we would normally discuss with the relevant specialist. But because we do have their numbers, when I'm in the clinic outside of Mahalape, I'm able to contact them and discuss the case with them. Thank you, Merck Foundation, for sponsoring. Yeah, thank you.